Welcome. We are doing a review of the arteries of the thoracic limb. Remember that starts way in here with the subclavian artery first, which you may or may not be able to see. The first, when I say first branch, one of the branches that comes up to the neck and shoulder is the superficial cervical artery. That actually arises from subclavian. Then it changes names to can we back up? Axillary artery. That axillary artery is going to come down, and you're going to see branches that come to the superficial pectoral muscles. If it goes to the superficial pectoral muscle, we're going to call it an external thoracic artery. This particular dog happens to have 2 of those. Is that okay? Yes, that is fine, as long as you name it by where it goes, not by where it came from. We see this other branch coming off, and if you were to describe where that branch went, it would be going to the deep pectorals. By definition, the branch that goes to the deep pectorals is going to be the lateral thoracic artery. Main channel is still axillary, right? We were subclavian, axillary, we're still axillary. Now we're going to look for this large vessel that comes off of the axillary, and this is called, got it? Yeah. This is called subscapular. That entire piece is subscapular. It's going to then give rise to a few different branches. One of those would be thoracodorsal, going to latissimus dorsi. Give me a second. There will be a branch that dives deep underneath the humerus, and we're going to call that caudal circumflex humeral. Think about the name. It's going caudal around the humerus. The continuation of this huge subscapular will then just be subscapular. So it's like the subscapular road gave off a thoracodorsal road and a caudal circumflex humeral road. Main channel still now changes names to brachial after subscapular. One of the things that we're going to look for is a branch such as this. It's called the cranial circumflex humeral, and it's cranial circumflex around the humerus. We had caudal circumflex humerals back here, and the cranial is just going to join in with it around the humerus. This is part of that collateral circulation that we talked about in lecture. So main channel here remains brachial. We move down from brachial, and I can see, these vessels coming into the triceps, and specifically they are diving between the medial and the long head of the triceps muscle. If you see 1 or 2 or just 1, I don't care, you're going to call it deep brachial. In this case, we happen to have 2 deep brachial arteries. Is that okay? Sure it is. And this is again why we name it by where it goes, not by where it came from or the branching pattern. Our main channel maintains its name as brachial artery. And we continue down the brachium until we see this branch that's coming over to the ulna. And all of this is called collateral ulnar artery. Did I talk about the cranial circumflex humeral? Okay. On the deep end, or the distal end of the biceps, we're going to have this, the bicipital artery. This is going to be superficial brachial. It's still in the brachium. And when it crosses over into the antebrachium, it becomes this makes sense, cranial superficial antebrachial artery. And this is that artery that's going to run on either side of the cephalic vein. One of the other vessels that we look for right around the elbow joint. Hold on 1 second. Are you getting it? Mm-hmm. Okay. This one is the transverse cubital. When I say the word transverse, you need to think about going between. It transverses the cubital joint. So it dives deep into the cubital joint. What is main channel here? It is still brachial. Now, this is where everybody gets kind of crazy. Because there are tons of, I'm trying to get these nerves out of your way, but there are tons of arteries that come to the caudal aspect of the antebrachium. And all of those arteries that go and plug into the flexors of the carpus and digits, we're going to call them all deep antebrachials. So in this particular specimen, we'd have 1, 2, 3, 4 of those. Is that okay? Sure. You just need to see if it goes caudal to the flexors, it's called deep antebrachial. The one that we're really interested in looking for, can you twist that?
Can somebody else hold this light? It's a little dark.
Is common interosseous. When I say interosseous, that means it goes between two bones. And so the common interosseous will go between the radius and the ulna. There are branches that come out from that which you do not have to identify. However, you may use them as an answer for blood supply to a particular region. Specifically, if it comes out to the ECLU muscles, extensors of the carpus and digit, the cranial interosseous will do that. The caudal interosseous is a real deep one, and it's going to run deep between the radius and ulna. The other branch off of the common in the dog is called the ulnar, and we're going to find it running with the ulnar nerve in just a second. So once the common interosseous comes off, main channel changes from brachial to median. The median artery is now main channel, and it's going to come down. I wish I had a smaller one. Anyway, it's going to come down, and this is radial coming to the dorsal aspect, and median is going to be coming to the palmar aspect of the manus. And remember, then we're going to have a superficial palmar arch in a dog, and then palmar common digital arteries for the superficial, and palmar proper digital arteries to each of the different digits. So that concludes our examination of the arteries of the thoracic limb.